Welcome back to MedTalk. I'm Brad.
And I'm Kassidy. Today we're talking about something we see every single day in community pharmacy, whether pharmacist care actually changes health outcomes, especially for blood pressure and diabetes.
And the short answer is yes, usually in helpful, practical ways. Not magic, not overnight, not all by ourselves. But when researchers look across reviews of many studies, pharmacist involvement does tend to improve blood pressure control and medication taking.
Right, and I like saying it that way because sometimes people hear pharmacist-led care and think we're claiming we swoop in with a cape and fix everything. That is not it.
No cape, probably for the best.
Probably. But seriously, when researchers pool hypertension trials together, they keep seeing a pretty consistent signal. Patients who get pharmacist interventions often have a greater drop in systolic blood pressure than people getting usual care alone.
And one of the well-known numbers from those pooled studies is about a 7.6 millimeter mercury greater reduction in systolic blood pressure. You can round that in conversation and say roughly 7 to 8 points lower. That's meaningful. In the real world, that's not a tiny change.
Exactly, especially because high blood pressure usually doesn't make you feel dramatic symptoms day to day, so people can think, I'm probably fine. Meanwhile, numbers are creeping up, doses may need adjusting, refills might be late, side effects may be making them skip tablets. There's a lot going on under the surface.
That's where regular pharmacist contact can help. Sometimes it's education, sometimes it's catching that the patient is taking the medicine differently than intended. Sometimes it's seeing that a reading has stayed high long enough that the prescriber may need to hear about it.
And diabetes is similar, though the effect size people hear about is usually more modest. Reviews focused on diabetes generally show improvements in A1C when pharmacists are involved in ongoing medication management. Usually not some wild, unbelievable drop, more like modest but clinically meaningful improvements.
And modest matters. I think that's important. Folks sometimes dismiss anything that isn't dramatic. But if your A1C comes down, your adherence improves, you're taking medicine more safely, and you're actually following through on monitoring, that adds up.
Yeah, and adherence is a huge piece of this. A medication can't work if it's sitting in the bottle on the counter, or in the truck, or mixed into 3 different bags because life got busy.
Or in the beach tote from last month. We do live near the coast.
That too. But really, reviews of many studies keep pointing in the same direction. Pharmacists help people stay on therapy better, understand it better, and use it more consistently.
And I want to be careful here. Pharmacists do not cure hypertension or diabetes by standing near you. The benefit comes from the work, checking the regimen, spotting medication-related problems, helping with adherence, coordinating with prescribers, and making sure the patient can actually carry out the plan.
That's the key. It's not some mystery effect. It's lots of small, concrete things done well and done regularly.
That's been my experience for, goodness, over 3 decades now. When people feel known, when somebody notices the details, when they have a place to ask, now, wait, do I take this with food or not? Outcomes tend to be better.
And those details are not boring details. They're the treatment. That's kind of the whole point of today's episode. So let's talk about what we actually do during a medication review, because I think a lot of people still picture pharmacy as counting pills, putting on a label, and saying, "Have a nice day."
Well, there is some pill counting. I don't want to mislead the public.
Fair, but that's not the whole story. A real medication review is more like stepping back and asking, is this regimen making sense for this person right now?
Exactly. We look for duplicate therapy, 2 medicines doing nearly the same job when maybe only one is needed. We look for side effects that may be causing somebody trouble, but they've never connected it to the medicine.
We look for missed doses too, and not in a judgmental way. More like, what's getting in the way? Is a schedule too complicated? Is the patient unsure what each medicine is for? Is cost part of the issue? Is a noon dose impossible because they're working, driving, caregiving, living a normal life?
We also look at underdosing and overtreatment. That's a big one. Sometimes the medicine is there, but it's not enough to control the condition. Other times the regimen may be more than the patient currently needs, or it's lowering something too much, or causing dizziness, fatigue, low sugars, that sort of thing.
And interactions. Prescription with over-the-counter products, sometimes even with supplements. People are often surprised by that. They'll say, "Oh, I didn't think that counted." It counts.
Sure does. And after we find those issues, the impact usually comes from changing the details. Maybe we recommend a dose adjustment to the prescriber. Maybe we suggest simplifying the regimen so it fits the patient's routine better. Maybe we help set up an adherence plan, pill boxes, refill synchronization, reminders, whatever is realistic.
Or we prompt follow-up monitoring. That's a quieter part of pharmacy care, but it's important. If blood pressure is still high, if sugars are drifting, if a medicine was recently started or changed, somebody needs to check back in. Otherwise, everybody assumes somebody else is watching it.
And that assumption can get people in trouble.
I might be old-fashioned on this, but I still believe in picking up the phone, sending a clear note, making sure the prescriber knows what we're seeing. Good care is coordinated care.
I agree, and this is where the myth falls apart. The idea that pharmacists only dispense medicines. Dispensing matters. Accuracy matters. Safety checks matter. But pharmacists also help optimize how therapy is chosen, used, and monitored over time.
Yes, we help answer, is this the right medicine? Is it the right dose? Is the patient actually able to take it? Is it working? Is it causing harm? Does somebody need labs, home readings, or a follow-up appointment?
And if you've ever had one small problem with a medicine snowball into a bigger one, you know how valuable that can be. A cough turns into stopping a blood pressure pill. Stopping the pill turns into uncontrolled readings. Uncontrolled readings turn into an urgent visit. The first domino usually looks small.
That's well said. Pharmacy care often lives in those first domino moments. Catch it early, fix the detail, keep the whole plan on track. So this brings us to why medication reviews matter so much. They connect all that evidence we've been talking about to real people with real routines, real budgets, and real questions.
Yes, because better outcomes in pooled studies sounds nice, but what does that look like on a Tuesday in Southport? It looks like catching the blood pressure patient who's taking one tablet instead of two because the bottle changed. It looks like noticing a diabetes patient never started the new medicine because they were scared of side effects and didn't want to bother anybody.
Or the patient seeing two doctors and ending up with duplicate therapy. Or the one who's feeling weak and lightheaded because treatment may need rechecking. Or the person faithfully taking everything but at the wrong times in a way that makes adherence harder than it has to be.
Medication reviews help catch those problems before they turn into uncontrolled blood pressure, poor glucose control, or avoidable harm. That's really the heart of it.
And follow-up matters. One conversation can help, sure, but regular pharmacist follow-up tends to work best when it's personalized, practical, and coordinated with the prescriber. Not generic advice, not a lecture, a plan that fits the patient's life.
I love that word practical, because if the plan is medically perfect but impossible to follow, then where was I going with that? Oh, right. The plan isn't really working. It has to be something the patient can actually do.
Exactly. If a person remembers morning medicines but never lunchtime doses, that matters. If opening the bottle is hard because of arthritis, that matters. If cost is leading to skipped refills, that matters. Personalized care means we don't pretend those are side issues.
And coordinated care means we're not trying to replace the prescriber. We're working with them. We see medicine use up close. They see the bigger diagnosis and treatment picture. Patients do best when everybody communicates.
That's a good counterpoint to mention again. Pharmacists do not magically fix disease on their own. Better outcomes happen because the whole process gets stronger. Therapy details are improved, medication-related problems are spotted, adherence gets better, follow-through improves, and the right concerns get back to the prescriber.
So if you're listening and thinking, I take several medicines, but I don't really know if all of them still make sense together, that's exactly why a medication review is worth asking for.
Bring in your medication list, or bring the bottles in a bag if that's easier. Prescription meds, over-the-counter products, vitamins, supplements, all of it. Let us look at the whole picture.
It can be one of the simplest ways to improve treatment results. Not flashy, just smart.
And neighborly, which around here still counts for something.
It absolutely does. Thanks for listening to MedTalk.
Feel free to contact us with any questions you might have. We are here to support every one of your health needs. Supply location: 58 Physicians Drive Northwest, number 5, Supply, North Carolina. Open 9 a.m. to 6 p.m. You can call us at 910-754-7200. And Southport location: 1513 North House Street, number 8, Southport, North Carolina. Open 9 a.m. to 6 p.m. And you can call at 910-454-9090. We'll be back soon with more practical conversations from the pharmacy counter.
Bye, y'all.
See you next time, Kassidy.